Back here in Accra, scores of unemployed nurses have hit the streets of Accra to demand their immediate postings by the Ministry of Health. They are presenting a petition to Parliament to mount pressure for them to be posted. My colleague Samuel Mbura is with the protesters. He joins us live with more. Samuel, what can you report from the Ministry of Health?
Some nurses that have not been employed for a couple of years now, Asha, they are asking that the ministry should immediately employ them because they can no longer live or survive for the fact that they are not employed. And what they are asking the ministry to do is that they should immediately look into their predicament and see how they can help them come out of these challenges that they are facing. So let me talk to one of the leaders. What's your name?
My name is Charles Pandago.
All right. So who are you in this association?
I'm the president of the NAC and the NAP.
If you say NAP, what does that mean?
That's Registered Nurses, Clinicals, and Registered Assistant Preventive.
All right, so meaning this demonstration captures all the categories of nurses under the Ghana Health Service. Is that what you are saying?
Yes, please.
All right, so tell us what your predicament is.
Right now, we want the government to know that we are tired in the house. We want the government to know that this time we are not coming easy. What we are doing is that right now, he must post us by force, either he like it or not, because we have suffered a lot in the house. Our mothers are crying. Our mothers didn't even have. They try as much as possible to pay our school fees for a good 2 years and 3 years. And we are still in the house.
For how long have you stayed at home?
Almost 3 years.
3 years?
3 good years.
And what has been the correspondence between you and the ministry?
Anytime you write a letter to them, they will ask us to come back. We sit with them, we talk. They assure us, okay, next week, soon, next week, we should wait. We are on board, we are doing meetings, we are doing this. Every day, about getting 3 years like that.
Can you tell us the numerical strength of the nurses that are unemployed since 2019, as you say? How many are you?
Oh, my brother, I can't even count. 10,700 plus. 10,700 plus. Plus.
So how have you been surviving all this while?
In fact, it has not been easy. It is our mothers and our fathers and our grandmothers and friends that we are feeding from them. You understand? We have nothing to do because when you go, they know that you have a certificate. Even the private nurses, the private hospitals, if you want to go there, they know that you are a government assistant. So when they employ you and they post you, leave. So they will never take you. Am I going? Now we are selling pure water. We are selling tomatoes. In fact, my brother.
So you have diploma nurses and degree nurses, right?
Yes, please.
So your juniors, I understand, have been posted. Why is it the case that your situation is different?
That is what I'm surprised, because they don't have their clearance. They don't have their clearance yet. Why? How come they are posted? It means they paid money somewhere. So in this case, even
do you have facts to buttress your allegation that they paid money? Yes. What are the facts?
Yeah, we have the facts. We even have the facts on our phones. Yes.
That they have paid money.
Yes.
Paid money to who?
To the respective person they went to.
At the Ministry of Health?
Yes. Because how come they get posted and we the 2020 people have got posted and we the 2019 people have not posted?
So those who completed in 2020, 2021 have been posted, or is just 2021 alone?
Yes. Most of them. You understand? Not all of them. But those who were having money, pay to the ministry, and then they have posted them and they are working.
Do you have an ultimatum for the ministry if they don't listen to you?
Yes, we have a lot, but we don't want to say everything here. We want to go there for them to tell us what they have to tell us. If they don't tell us anything from today, within a week, they will see us more than even this.
What will you do? What can you do?
It's in mind. We can't voice it now, but when they fail to post us, that is why they will see that we are very serious for now.
All right, so we have arrived at the Ministry of Health. They are coming to present their petition, and they are under the full guard of the Ghana police here. So security is very tight here, and they now need access into the ministry's premises. But you heard them. On their placards, they are reading, "Post us now." They said 2019 referral badge, we need for clearance now. They are talking about clear us and post us now. So these are some of the demands that they are making, and asking that the Ministry of Health should immediately listen to them, because they can no longer survive under the current situation in the country. They are now relying on their parents. They are relying on friends to be able to survive. We'll try and talk to the Ghana Police Service to find out from them. Hello, sir. Are you able to tell us the security arrangements so far as this is concerned? All right. So for now, the police are not ready to talk on it, but we have arrived at the ministry there. So that is the current situation there. Let's listen to them.
Release our data. Release our data. We need clearance. Clearance. We need clearance. We need clearance. Release our data. Release our data. Release our data. Release our data. We need clearance. We need clearance. Release our data. Release our data. Release our data. We need clearance. No.
So, Asha, you've heard these nurses. They say for the past 2 years they have not been employed, and that's why they are at the ministry. They are at the ministry here. So we are at the Ministry of Health, expecting that the minister or a representative will come out and listen to the predicament of these nurses. But as you can see, the police have given them the necessary escorts and protection so far as this protest or demonstration is concerned.
Ministry of Health, where nurses are picketing and to demand for postings. They say they've been assured by the ministry severally, but it hasn't happened. They've stayed home for quite too long. They are suffering and they need to be posted. We'll take a break on Joy News today. When we return, there's more. Welcome back to Joy News Desk, and we can go back to the Ministry of Health, where nurses are picketing. They're currently presenting their petition and they're demanding that they be posted.
They've already presented their first petition. They are still waiting for other petitions as well, because these are different categories of nurses that have actually come together to stage this demonstration. So the registered nurses are supposed to present their petition. They're supposed to present their petition. Mr. Pandago is the one signing for, one of the categories of the nurses to present it to the leadership there. But I must say, security is very tight here. We've not witnessed any incident so far. It has been peaceful, and they have actually conducted themselves so well. And now to present their petition to the Ministry of Health here. So we are still waiting for some of them to continue to present their petitions there.
This is heartbreaking. Yes. 3 years in the house.
3 good years. Abba, what else have you done? Enough.
Over and over and over. It's been soon. And their soon is not soon in. We've had enough. We didn't want to do this, but this is the only way out. We've had enough of the reassurance. It's not helping any longer. Nap, we are tired. 3 good years after school, we are still home. We have accessed the portal for 6 good months now. We are tired. We need our data now.
Please and a big please, we are 2019 referral badge. Both referral badge and then the second badge. In fact, the government have been treated us unfairly in a standard 2020 badge. They just completed national service and they are working. We the 2019 badge, we are in the house. We are in the house. MOH, we are in the house. MOF, we are in the house. In fact, we are suffering. How can they sell our slots to our juniors? Once we the 2019 referral badge, we are in the house. Later on, they camped out there. They posted our 2019 badge. Whilst we are still in the house, in fact, what they are doing is not nice. What offense have you committed? What crime? In fact, we are tired. It is becoming unbecoming. We beg you, we are here pleading. We are sharing our grievances to you that we need immediate.
You've heard their concerns. What do you have to say?
Clear. We've received their petitions. we are going to make sure that we also present same to our authorities so that the work that we've started, we complete it successfully for them.
So according to the leaders of the group, they have had several conversations, several meetings,
and they have followed up with this. So yes, the work will be done for what has been started to be completed. So it will be done. Okay, take each other.
That is the HR here at the Ministry of Health, assuring that they will address their challenges. The HR at the human resource manager at the Ministry of Health, assuring them that their predicament will be addressed. So that is the situation here, but the nurses are not quite happy. They say the promises have been too many, and they think that by now action should have been expedited. They are also making some claims that their juniors have been posted, leaving them behind. A reason they are so much peeved about the situation. So that is the situation here, and after receiving the petition, we do expect that they will be dispersing from here. So for now, they are now going to disperse them to go back to their various locations. And you heard the police addressing them now.
Protect you to march through the streets to this place to present your petition. We have done that. You also promised us a peaceful demonstration. At this point, we think we have both made our points. We have presented the petition. The authorities will attend to it.
There's no response, at least. You should have
Listen, but the shouting will not give the response.
Yes,
so hold.
It is not satisfying. The answers they are giving us is not satisfying. So it means that today we are here purposely for the clearance and postings respectively. And as a matter of fact, our agenda here, he has not tackled that. We couldn't have the opportunity to meet Dr. Sabre, the director HR.
So that means that you are going against the words of your leaders. They have promised a peaceful.
It is a peaceful. We are the same leaders, and we are saying that no, it is very peaceful. Now, what we are saying is that the response.
So there's a bit of misunderstanding here. What the nurses are demanding is that they expect that doctor.
Samuel Mbura there with that report from the Ministry of Health, and you could see in the nurses who are demanding that the ministry post them, and they say they've not gotten the right responses they're looking from the authorities, and so they are protesting. We'll still bring you more of this in a subsequent bulletin.